Hello and welcome. My name is Dr. Manon Bolige, and I want to give you a little presentation on Bowen therapy. So, what we're going to cover is what Bowen therapy is, its mechanisms of action, and its therapeutic benefits. Also, give you a brief history of Bowen and its origins, not a live demonstration, but at least a TV demonstration, so you have a sense of it, and then Bowen case studies. So Bowen is a gentle soft tissue bodywork technique that works on the autonomic nervous system. When it's applied, it initiates the process of natural auto-regulation throughout the whole body. And this auto-regulatory effect results in a rapid elimination or reduction of symptoms, followed by an increase in energy and a sense of well-being. Bowen is a holistic therapy and aims to reintegrate the body-mind complex as a whole. It is often called contextual healing, consequently regarding illnesses as symptoms of imbalance. Bowen is a soft tissue osteopathic-like style therapy designed to address pain, physiological dysfunction, and even psychological imbalances by restoring the structural integrity of the body. The practitioners will gently roll his or her fingers, applying gentle pressure across specific spots on superficial fascia. And this response releases adhesions in the collagen fibers, allowing the tissues to rehydrate and to realign myofascial postural tone. The treatment itself is not prescriptive, it is responsive. In other words, we're continually assessing the need for intervention at different levels. Bowen therapy is a neuromuscular approach to health care that employs hands-on soft tissue manipulation for the correction of biomechanical and neural dysfunction. Its application is suitable and safe for all ages, from newborn to the elderly. And it is for this reason that there are no general contraindications, essentially rendering the technique useful for a wide range of conditions, from acute pain to chronic conditions. So what it can treat, you can read the list here yourself, but it's frozen shoulder, shoulder pain, tennis elbow, carpal tunnel syndrome, arthritic pains of all sorts, sporting injuries, headaches, TMD and TMJ syndrome, temporomandibular joint, scoliosis, migraines, postural problems, gait disorders, leg length discrepancies, plantar fasciitis, shin splints, fibromyalgia, foot and ankle problems, hernias, knee, hip restrictions, pelvic problems, repetitive strain injuries, and sciatica. It's not an exhaustive list, but these are examples of the kinds of conditions that you can treat easily. As well, it will help internally. Respiratory problems like asthma, bronchitis, hay fever, sinusitis, allergies, digestive disorders like constipation, colic, Crohn's disease, indigestion, bowel problems, and gynecological problems such as infertility, mastitis, premenstrual syndrome, and breast lumps. And on a general level, it will help chronic fatigue syndrome, fibromyalgia, Parkinson's, balance problems, tinnitus, bedwetting in children, hemorrhoids, prostate problems, earaches, and ear infections. Basically, there's a wide range of conditions that it will help, and in the next few minutes I'll describe to you why that would be the case. So the Bowen technique was brought to the forefront when a survey on alternative therapies conducted by the Australian government in 1975 revealed that a certain person named Tom Bowen was treating approximately 13,000 patients per year. His clients reported remarkable outcomes and achieved these results with only 2 or 3 sessions per client. In the end, an inquiry that initially appeared as a threat to his practice became a major promotion of Bowen therapy. And the word Bowen therapy was actually only coined after Tom Bowen's death, when it began to be taught. And this is a picture of Tom Bowen, who passed away in 1982. So this is a fairly young therapy. Now, Tom Bowen was influenced by several people, and one of the most known is Ernie Saunders, who was referred to in his time period as a legend in the 40s and 50s as a physical manipulator. And he had a great influence on Tom Bowen, introducing him to Japanese acupoints, as well as a version of Teely, which is a traditional acupressure approach, which is different from shiatsu, which was introduced by Tempeki Tamai in 1919, which is based on a Western medical approach to treatment. Tom Bowen had apprentices over the years that he practiced. There's Oswald Wrench, who's a massage therapist who spent 2 years with him. Then Keith Davies, a chiropractor who spent 7 years. Nigel Love, also a chiropractor at the end of Tom Bowen's practicing time. Kevin Neve, who was a chiropractor, spent also 4 years with him. Romney Smeaton, who spent about 5 years with him, who's a chiropractor, and Kevin Ryan, who was an osteopath, who spent basically the last 2 years with him. And Romney Smeaton went on to continue Tom Bowen's practice after Tom Bowen passed away, and saw his patients for another about 12 years. A little bit about Bowen College. It was founded in 2007 by myself. I'm a naturopathic doctor, and I was originally trained by Ozzy Wrench, and I've been a Bowen practitioner since 1992. So the goal and vision of my team of 15 instructors is to teach all approaches to the Bowen technique and expand the depth of knowledge, increase research, promote awareness of the therapy that Tom Bowen inspired. I would say that the approach is inclusive of all schools. There are many different takes, trends, and innovations, which is quite natural in all therapies. And the goal for Bowen College is really to train practitioners to excel in their understanding, their gifts, and really be able to help as many people as possible and get the support to do so. Bowen College has been accredited in Canada by the Canadian Examining Board of Healthcare Practitioners, and it is the only accredited school in North America. So how does Bowen work? Bowen therapy allows the body to reset and heal itself. The premise is that after the system has been rebooted, which is a term we use as an analogy to computer languaging, so after it's been rebooted during treatment, it is the body that takes over and does most of the healing. The treatment itself consists of a series of gentle moves on skin or through light clothing, with the client usually lying on a treatment table. A session normally lasts from half an hour to an hour and frequently results in a deep sense of overall relaxation, despite the severity of pain the patient usually presents with. There are pauses between certain series of procedures, which gives the body time to incorporate the information that it's given. The moves themselves require a great sense of tissue tension recognition, and thus are light, gentle, and very precise. Some of the moves are a bit stronger. There's no and it depends also on the sensitivity of the patient. But it is not a deep tissue type of therapy, just to clarify that distinction. It takes 2 to 5 treatments, which is the average amount of treatments necessary before seeing maximum results. There's 5 components to a typical move. First is the contact with the skin, the slack, the challenge, which I will explain in the next slide, a roll over the muscle through the fascia, and then a pause. So what is the challenge in Bowen? The Bowen moves are performed so that the therapist engages the lateral aspect of the belly of the muscle and maintains pressure as close to possible to the stretch reflex point without activating the stretch reflex. You experience the muscle giving or swelling just before you allow your fingers to gently move the slacked skin over it. Any perceived tensing of the muscle defeats the purpose, as it would activate the stretch reflex mechanism, which would otherwise cause an automatic muscle contraction and further irritate the muscle. The pressure must be just right so as to stimulate motor sensory neurons in muscle tissues to achieve muscle relaxation through the modification of sensory motor neurons sensitivity to muscle spindle stretch. This is achieved primarily through the Ruffini cells and the interstitial receptors, especially type 3 and 4. So just to go quickly through some of these slides, there's 4 types of mechanoreceptors, intrafascial mechanoreceptors, the Golgi, Pacini, Ruffini, and interstitial. And if we look at the proprioception and their actions, muscle spindles, these are found throughout the skeletal muscle, and each spindle is enclosed within a connective tissue capsule, and they're called intrafusal fibers, and these fibers detect when the muscle is stretched and initiates a reflex to inhibit the stretch. Golgi tendons, on the other hand, are proprioceptors located within the tendons near the muscle insertion points. And there are small bundles of collagen fibers that are also enclosed within a layered capsule. Their action is closely associated with that of the muscle spindle. However, when the Golgi tendon organs become activated, the action of the muscle is inhibited, which causes it to relax. The Pacinian corpuscles, these are scattered throughout the dermis of the skin and in subcutaneous tissues under the skin and joint capsules, where they monitor the amount of stretch. They are stimulated by pressure almost immediately. And Ruffini's corpuscles, these are in the dermis and subcutaneous tissues and the joint capsules. They resemble the Golgi tendon organs, which monitor tendon stretch. And very importantly, there's the interstitial intrafascial mechanoreceptors, which, as we saw above, 20% of these are type 1 and 2 Golgi. There's Pacini, Ruffini, and spindle cells. But 10% are type 3 myelinated and 90% are type 4 unmyelinated. Now, how is this relevant? Well, Pacini receptors, they're responsive to and sensitive only to rapid pressure changes and vibrations. And some of these Bowen moves are rapid and one would say would cause a vibration in the body. The Ruffini receptors increase local proprioceptive feedback for movement control. The Ruffini receptors, their preferred location are ligaments of peripheral joints, dura mater, outer capsular layers, and tissue associated with regular stretching. And they're responsive as the Pacini yet also to sustained pressure. They're especially responsive to tangential forces, which is basically lateral stretching. The Ruffini receptors, the result of the stimulation is an inhibition of overall sympathetic activity. And as we'll see a little bit further on, this is crucial to the work that is happening with Bowen therapy. The interstitial receptors, their preferred location is their most abundant receptors, and they're found almost everywhere, even inside bones. Their known results of stimulation are vasodilation changes, increased plasma extrusion, functions as a mechanoreceptor or nociceptor, and they have an autonomic reaction as feedback. So Bowen therapy helps the body remember how to heal through its stimulation of the proprioceptors, the sensory neurons the body uses for proper movement, balance, and sensation. The messages sent to the nervous system remind the body to regain normal movement in its joints, muscles, and tendons. In its unique manner, it sends corrective signals through the body along these same pathways. So when Tom Bowen developed the system of healing, later termed Bowen therapy, he placed emphasis on its clinical outcomes. Some of the theories and understanding that explain the mechanisms have only come with hindsight, and they include the stimulation and rebalancing of the autonomic nervous system, which we've looked at somewhat, interference with neuromuscular pain loops, stimulation of energetic currents in the body, the joint proprioceptors, whether it's spindle cells, Golgi tendon cells, neurolymphatic points and lymphatic circulation, fascia through mechanoscell receptors, Ruffini and interstitial cells, and correlation of many points with traditional Chinese medicine and meridian lines, as well as a correlation with marma points, which is an ancient Ayurvedic medicine. So Bowen restores parasympathetic function, which means that spasm and inflammation, which are normally normal and healthy reactions, immediate responses to an injury, often remain long after and become the problem. So what Bowen therapy, what it can do is it can directly relieve these symptoms through reducing sympathetically maintained muscle contraction. The parasympathetic portion is reciprocally restored, increasing blood and lymph flow, feeding starved tissue, and reducing inflammation. People can feel shifts in their bodies during and after Bowen sessions, while the autonomic nervous system comes back into balance. And I'm sure you're well aware of the different functions. The simple way I explain it is that sympathetic is for fight, flight, and freeze mode. It's our reactive mode, whereas parasympathetic functions are really our rest, digest, repair, and restore modes. The Bowen technique allows for the dynamic integration of the central and peripheral autonomic nervous system. The specialized moves used in Bowen procedures are directed to areas where proprioceptors abound, but it is the configuration of how the moves are performed that also elicit a relaxation response. The relaxation response is achieved through specific actions of the mechanoreceptors, which we've talked about earlier, vagus tone, activation of secondary respiratory mechanism through the healthy maintenance of the pumping action of the cerebrospinal fluid, and the healthy positioning of the sphenoid, thus maintaining optimal function of the pituitary responsible for the secretion of 9 essential hormones. There have been studies done using heart rate variability equipment that confirm a deep parasympathetic response is heightened throughout the therapy and in particular during the rest periods. I've cited many of the studies that do exist on Bowen therapy at the end of this presentation. Bowen therapy follows very well laid out principles of osteopathy. And osteopathy is a medical discipline that treats form and function of the body with manual therapy and states that structure and function are interrelated. Form, which is structure, governs function, which is movement, and function maintains form. Bowen therapy is a fast and effective way to reintegrate function and provide for structural integrity. So the objective in Bowen is to remove held patterns of pain and physiological dysfunction by restoring the structural integrity of the body. The merits of restoring structural integrity cascades to optimal physiological integrity, including hormonal systems, immune capacity, and detoxification. A physiologically sound body not only affects digestion, but also brain health, sleep, and the ability to heal. When it comes to pain, we are particularly concerned with the ability to perceive and process pain physically and from a trauma perspective. Studies have shown that there are no pain signals per se being sent to the brain. Instead, there are pain perception signals. This is called nociception. These are noxious danger signals that are being sent to our brain for it to decide whether one should feel pain or not. You can have pain without nociception and nociception without pain. A theory called the neural matrix theory accounts for pain as a result of peripheral nociception. For example, inflammatory cascade stimulating pain receptors, whilst also providing an explanation as to why someone can feel pain in the absence of peripheral input. Pain is an experience which is modulated at many levels. Pain can present without any peripheral stimulus, such as phantom pain. And similarly, nociceptive input doesn't necessarily lead to the experience of pain. For example, those wounded in war that have no pain at the time. But untreated trauma will likely play into one's perception of pain and will reinforce the pain cycles. This is because any experience that triggers the fight, flight, and freeze response in our bodies sets a new threshold for pain association. In the future, an innocuous trigger might remind the body of this original trauma and thus decrease the pain threshold and all the associated emotional concomitants. When pain is associated to trauma, there are numerous other health conditions that can be attributed to the autonomic nervous system becoming frozen in this state of protection. Let's not forget that the autonomic nervous system regulates the digestive system through the enteric nervous system, our detoxification pathways through our liver, kidney, and skin, our respiratory and circulatory systems. Untreated trauma will play into the perception of pain and will reinforce pain cycles. Our body believes that the trauma is not over, even if our mind has another version of reality, which is why we must treat the trauma in our body. Through felt body experience, we can best impact physiological stress. And I think that's really the absolute benefit of using Bowen therapy is that the patient actually experiences this parasympathetic, their parasympathetic system working, and the pain greatly diminishing on the spot. And as Dr. Reginald Capian says, who's a psychiatrist, pain specialist, and director of Pain Relief Center, she says, stress is intimately linked in part because it ramps up your nervous system and sensitizes it. When you've got a rapid heart rate or you're sweating, your nerves are primed to feel sensory input. If you have a syndrome like this, you're going to feel things more. And when this continues into chronic pain, you're basically sensitized to a very to a continual feeling of pain, which can only be broken if you can address that trauma. One of the most clinically relevant examples of this is how rehab and its auxiliary therapies does not put people into parasympathetic mode, nor consider that the fascia might be locked in a trauma state. Most rehab work involving high velocity, low amplitude manipulations or physiotherapy, which is directed to muscular rehabilitation, would be more beneficial and effective if it would engage a parasympathetic response, as well as rendering the fascia more fluid. How could trauma just affect muscle and bone, if you think about it? Why wouldn't it affect everything? If superficial fascia overlays bone and muscle, and that the fascia is highly innervated, as we've seen, it would stand to reason that it too would be affected. Now, from another perspective, what's called blood stagnation or qi stagnation in Chinese medicine, which is used in sports injury, requires work on the fascia, specific work designed to make the fascia more fluid, conductive, flexible, adaptive, and pliable rather than rigid. Bowen is a myofascial therapy that enables self-regulation through cross-fiber innervation of mechanoreceptors. So let's not forget that pain is the result not only of an original cause, but of the many defensive posturing the body takes to compensate for the original injury. The key is to untangle this pain web of compensatory feedback loops. And how better to achieve that than with a holistic therapy that engages every system in our body. Spasm and inflammation, normally healthy responses immediately after an injury, too often remain long after and become the problem itself. Bowen therapy can directly relieve these symptoms through reducing sympathetically maintained muscle contraction and increased blood flow and lymph flow. So how does Bowen treat spastic hypertonic muscles? So let's look at a few points to consider. Pain is usually detected when deeper insidious spastic muscles touch surrounding tissues, such as the fascia, especially nerves. Nerve entrapment is caused by chronic overcontracted muscles. And that's typical of sciatica, for example. Trigger points are irritated nerves under spastic muscles. And the body's natural response to pain and irritated muscle fiber is endorphin release, which helps to camouflage the pain, but fails to address the spastic hypertonic muscles that are at the core of the problem. And obviously pain medication, it's the same idea. We're still not resolving the problem. So first, we need an understanding of the erroneous feedback loop. If the muscle is in spasm, the cerebellum interprets the weak signal to mean the skeletal muscle, upon which the spindle is reporting, is relaxing. that there aren't enough fibers contracting in that particular muscle to maintain a proper amount of muscle tone, which is a preset requirement. So it erroneously orders up more contraction through the motor nerves. So the short-term effects of hypertonicity and the insidious cycle of spasm. So what happens is the cerebellum receives information from the muscle spindle as to the amount of fibers being contracted in each skeletal muscle. It then compares this amount with its pre-programmed requirements and makes adjustments accordingly, either relaxing or contracting more fibers in the muscle. But when the spindle cell becomes inundated with lactic acid, which is a byproduct of anaerobic sugar metabolism, it distorts the feedback nerves to the cerebellum, weakening their signal. Pyruvate, a byproduct of muscle metabolism, can be cleanly burnt if there is enough oxygen in the muscle. If there is not enough oxygen in the muscle, pyruvate turns to lactic acid. Oxygen fails to perfuse the muscle when a muscular contraction is strong enough to shut off its own blood supplies. So more fibers contracting results in less circulation in the muscle. The round skeletal muscles squeeze off their own veins during contraction, and more lactic acid is produced and trapped in the spindle, which further weakens the signal from the feedback nerves. The cerebellum reacts to each moment, ordering up more contraction. A vicious, unending cycle of self-sustaining spasm begins. And over time, this pattern intensifies and becomes permanent unless it's treated. Now, cardiac muscle is spared, as it can burn lactic acid and is non-spastic in nature. Flat muscle is mostly spared, as it can't become hypertonic and encapsulate lactic acid except at its attachment to bony structures like the gluteus maximus and medius. And it is most skeletal round muscles that are subject, or it's mostly skeletal round muscles that are subject to hypertonicity and this insidious cycle of spasm. So further compounding the complication is ligaments get involved when the muscle tendon unit is breached. So we just went through explaining how the muscle becomes hypertonic and how it no longer receives circulation, nutrients, anything, and it stays in this state trapped with lactic acid. So ligaments do not become involved in maintaining the integrity of movable joints unless the muscle tendon units are breached. They act as a backup to the muscle tendon unit. So when the muscle seizes up permanently and becomes hypertonic, it puts more stress on the tendons, and the tendons become extra fibrotic. With additional stress, as it increased muscle contraction, overstretching the springs, the tendons have the ability to call for more springs. This spreads the stress over a larger number of springs, and this extra fibrosity makes it harder to move and stretch the tendon as it loses its elasticity. So more fiber equals less stretch. So what happens after strenuous activity? Sore aching muscles are a sign that not all of the lactic acid was flushed out. Some remains trapped in the spindle cells. And why is this? Basically, the lymph ducts utilize skeletal muscles to pump lymph fluid towards the heart. When the level of lactic acid has receded in surrounding muscle tissue, the duct then helps to flush the spindle and dilute the acid. In people with hypertonic muscles, the levels of acid accumulate to the point that muscle contraction becomes locked in for a period of time. And this contraction both continues to produce lactic acid and blocks circulation in the veins. The veins are susceptible because they have such thin walls and so little blood pressure. The lymph duct is actually trying to remove the lactic acid, but when the surrounding muscle is so full of it, the duct ends up drawing it into the spindle. And that is how the erroneous feedback loop is set, telling the cerebellum that the muscle is weak and needs further contracting, when in fact it is over-contracted and flooded with lactic acid. So the long-term effects of trapped lactic acid. Well, lactic acid will wreak havoc to our circulatory system, injuring our arteries, contributing to cholesterol plaquing and blockage. Capillaries, venules, and veins are constricted, as well by spastic muscle, causing premature aging. It affects the nervous system mechanically by provoking a guarding reflex, and affects the endocrine system, causing metabolic and immune stress. Orthopedic stress is seen as the spastic muscle becomes more fibrous and tendons thicken and calcify, compressing joint cartilage and spinal discs, making them thinner and more dense and causing them to bulge. As a point of interest, lactic acid is also the reason that cancer cells are protected and white blood cells can't penetrate the lactic acid capsules. In Chinese medicine, lactic acid is likely what is called phlegm nodules. So Bowen and how this resets hypertonic muscles. The key in Bowen is to activate a renewed connection between the cerebellum and the muscle spindle cells so as to normalize muscle tone without engaging the stretch reflex. Furthermore, activation of cells within the fascia, such as the Ruffini cells and the interstitial cells, contribute to this process. And it is this way that we're able to bring back circulation, nutrients, help the lymphatic flow, and remove the lactic acid, and also stop this negative feedback loop that continues to make the muscle spastic. So this is why it's so profound, and yet we work through the fascia in a light way to achieve this. And why we do not recommend stretching is because muscles that won't stretch very much indicate fibrotic tendons and additional springs to hold additional stress. So repeated or intense stretching will activate the stretch reflex mechanism and drive the muscle crazy by changing the set point beyond healthy protective limits, therefore increasing the risk of injury. Stretching will do nothing to tendons except possibly thicken them with more coils, as the shortened muscle bellies have essentially lost their range of motion. Now, from another perspective, the Meridian Connection. So we can see at this point, just through simple physiology and through our understanding of the fascia, what effects Bowen can have. But there's a whole other component to Bowen, which is really much of the locations, or many of the locations of the points, are on meridian lines. So every part of the musculoskeletal system is related to a main meridian and its associated submeridians. The nature of the channels is such that the somatic and superficial tissues can reflect changes at the internal visceral levels. Many scholars now believe that the meridian system is in fact the body's vast network of fascia. And if we look at, the superficial fascial lines, deep front lines, lateral lines, spiral lines, and superficial front lines, we can see that there are many, it's exactly in those paths that many of the meridians lie. What's interesting is in Anatomy Trains, Thomas Meyer, 3rd edition, Thomas Meyer wrote, or added on a page later in the book, initially we deliberately omitted any comparison to the acupuncture and similar meridians. The close relationship between the two, however, is inescapable. The superficial front line, superficial back line, and lateral line show significant overlap with the stomach meridians, bladder meridians, and gallbladder meridians, respectively. The forearm lines correspond quite closely to the pericardium, lung, small intestine, and triple heater meridians, respectively. The deep front lines correspond to the liver meridian. And here's an example of an acupuncture chart, or partial acupuncture chart, and many of the points that we use where we actually make these Bowen moves coincide with the meridian lines. I'll just give one example. Stomach 12 is very helpful when pain of the shoulders radiate to the neck. It's also useful for pain of the supraclavicular fossa. Well, one of the functions of this point is to remove chi stagnation in the channel. It therefore is a very important point in alleviating pain of the shoulder radiating to the neck, problems with arm abduction, and pain in the upper body. The cervical aim, which is one of the Bowen procedures, is used for all of these problems, drawing once again commonalities between the indication of the Bowen moves and their corresponding acupuncture points. The cervical aim is also helpful for relaxation, headaches, and migraines. And when looking at TCM, benefits of stomach 12, we find that this point has a calming effect on the mind, Chen, merely due to its sending qi downwards, that is to say, subduing the rebellious stomach qi. This protocol, therefore, is used in treating insomnia, anxiety, headaches, and migraines, which is what we do in Bowen therapy. We also make use of the meridian cycle and the 5-element theory. So there's many ways of with an understanding of Chinese medicine and of Bowen, of really accelerating the healing process and understanding how deeply we can actually help a person heal. Now, I have an interview here with Dr. Shapiro. It's an old interview, but it will give you an opportunity to see how Bowen is done, some of the moves, the feeling of it. And when I was filmed, this was actually done unplanned. So the crew came to my office, actually just 2 days before I moved, and took some video of somebody that actually worked for them and had had frozen shoulder for 7 years and had seen, therapies of all types, therapies I recognize and therapies I've not even heard about. And so it was really a show to, I would think, to show that possibly this can't work so simply. And it was interesting because after 2 sessions, this person recovered fully. And I had an interview later, I think it was a month later, in studio, where she explains what happened. So I'll just turn on the video here.
Today on Balance, the Bowen technique for pain, food for thought on ADHD, conquering Everest with Rod Black, and Degrassi's Pat Mastriani on his healthy life. Hello, I'm Dr. Marla Shapiro. From Europe and the Middle East to Australia, the Bowen technique is becoming increasingly popular, and now it's available right here at home. Bowen has helped patients overcome a myriad of problems, such as migraines and back pain, using simple touch. We followed a new patient to the Be Well Now Bowen Clinic for a treatment.
Essentially, the Bowen technique is a soft tissue manipulation that addresses all kinds of structural issues and also pain. It's an excellent tool for pain management. Today we will be seeing Heather. It'll be her second visit and her first shoulder treatment. She has had 2 car accidents 7 years ago and has been in pain since then.
What drew me to the therapy was that I had tried other kinds of therapies. When this first happened, I went a traditional route with physiotherapy and my doctor. I tried chiropractors, I've tried acupuncture, I've tried massage therapy, I do yoga, and that helped for a while, but it came back.
So right there, you're starting to have pain. Are you able to bring it further, or the pain will prohibit it?
I could probably bring it further, but it's very, very, very stiff.
Okay, so at the first visit, there's an extensive case history that's taken to see what is the main ailment that they have. Typically, the first visit takes about between half an hour to an hour. We treat the entire spine by treating the muscles around it. And then on a following visit, we would then be more specific to the joint or to whatever is out of alignment.
The sensation of relaxing is quite amazing. Just when you're on the table, I don't know if, you'd have to have a certain amount of body awareness maybe to realize it, but the muscles just kind of collapse into themselves. You relax instantly. I've never felt anything like it. I like the idea that it's not quite so invasive as some of the other types of therapies for muscle and bone problems.
Everyone can benefit from the Bowen technique. It's used for infants if they have colic. It's used for elderly if they have digestive problems. It's used for any types of osteoarthritis, tennis elbow, carpal tunnel syndrome, sciatica. So, for pregnancy, it's wonderful for any types of conditions.
Take this arm and just bring it up. Oh, okay, go ahead. Oh my gosh. Oh my gosh. Okay, holy smokes. Okay, that's astounding.
Our success rate is about 85% with most conditions. An indefinite treatment, once the person has established a state of rebalancing and health, then there is no reason, unless they re-injure themselves, that the pain should return.
I think everything's curable. I don't think there's a reason to live with pain.
Now, Bowen practitioner Manon Bolliger and her patient Heather Hamilton join us to talk more about the benefits of the Bowen technique. So how are you feeling?
Oh, I feel terrific. My shoulders never felt better.
Still normal range of motion?
Oh, completely.
Can you reach over your head?
Yeah.
Reach behind? You really can do that, and you couldn't do that before?
Not at all. No, this is just a miracle to me.
Well, for anyone who's had a frozen shoulder and has gone through painful treatment that doesn't have range of motion, this really is remarkable. Manon, tell me how this works. It seems so gentle, yet it reminds me a little bit of active release of the tendon or some chiropractic massage. How does it work?
Well, essentially, it's a technique that allows the body to go into parasympathetic mode right away. And essentially, it's by stimulating the local nervous system, either the spindle cells, Golgi cells, receptors, or proprioceptors. It feeds back a relaxation loop to the central nervous system, and then the muscles release, and the body's able to readjust itself.
And it's through that release and the readjustment that it's so effective in all these different areas, from fibromyalgia to migraines. There's a whole list of things that Bowen is thought to be helpful for. So you find that it really does make a difference. Once Heather's been treated and you now have a normal range of motion, is this likely to come back, or is this something
and that's another thing unique to this treatment, is that most people get better in 2 to 5 sessions, and then it stays like that. There's no reason for the body to undo this because the pain and spasm loop has been broken.
Well, thank you so much for being with us, and continued range of motion in your shoulder. Coming up on Balance, food for thought on ADHD.
And to finish up, I want to share with you a few case studies. NM is a 50-year-old female. She has a history of ovarian cancer, hepatitis A. She's perimenopausal since 2002. Her chief complaints were sleeplessness, moodiness, which is more extreme now, flushes lasting 4 hours if she's anxious, neck tension since year 2000, can't drive because she can't rotate her neck, pain on rotation 9 out of 10, ankle sprain and wears a brace since 1994, went to UBC Sports Clinic and told that the brain connection not there, that's quote unquote, and prescribed a series of exercises by Dr. Blaney. So she came, her first visit was the 14th of October 2004, and I treated her with Bowen therapy. So the 19th of October, following the treatment, she had diarrhea, urgency with urination, increased bloating and flatulence, mood worsened, and she saw no positive change. So this at first could sound alarming, but when you give the body information, the body is set to heal. So if it requires to have a process of elimination and detoxification, it will do so. Some people call this a healing crisis. Whatever it is, it may not be pleasant, but we continued with the treatment because usually patients will tell you, despite what their body is experiencing, there's a sense that they feel better. So we did another treatment, and on the 28th of October, she was very pleased with improvements. The pain in the neck was 2 or 3 out of 10. She had full range of motion while driving. She slept better. Her temperature regulation improved. Her mood was much steadier. So we continued another treatment. And on the 15th of November, she was not wearing a brace anymore. Her pain in the neck was barely perceptible, and her sleep was normal. With Bowen, you don't give treatments typically more than once a week, and the reason for that is to allow the body to integrate the information and to really prompt itself. It's been prompted for self-healing, and the rest, the body knows what to do. The 3rd of March, her neck was still no problem. So again, this is, let me go back here. So 15th of November, so this is 4 months later. Her neck was still no problem. She had increased range in ankle movement, but 3 days ago, she had anxiety attacks because of a cancer scare in her right breast. So at this point, she elected to have surgery, a double mastectomy, because 9 out of 15 females in her family died of cancer. I did still Bowen therapy, this time to help with the anxiety, because obviously with the anxiety, you have lack of sleep, and all of that weakens your immune system. On the 4th of May, she came back, 17th. Okay, during that period, she followed, okay, from the 4th to the 17th, she followed a self-elected protocol, which was chelation therapy with another MD. The 17th of May, a year later, she returns with lymphedema, had 7 lymph nodes removed, 8 rounds of chemo, 28 rounds of radiation prior to a double mastectomy and hysterectomy. She has pain in her hips, is dizzy, decreased range of motion in arms. But what's interesting is, despite following a therapy that I had not personally recommended, she came back because she knew that her body was able to heal. And this was all preventative measures. Apparently, she actually did not have a relapse in her cancer. The treatment I did, again, was on the 24th of May, was Bowen, and now July 06, she's still doing very well and has no symptoms, no pain, and her original problems are all gone. The 11th of September, she relapses with pain in the wrist and hip and some lymphedema. We do Bowen, 30th of October, the follow-up, she's still fine. She comes back half a year later for another tune-up. And a few months later, her hip hurts because she's in a dance class and her right arm has slight swelling. We do Bowen. And finally, September 2007, all is well, and she'll call if anything goes off again. And this would be a very typical experience. I've been doing this now for almost 24 years. At first, there's 3 to 5 treatments, even if there's a whole bunch of things wrong. Then we slow it down, take some breaks, life comes up, things happen, people check in, and then they check in sort of less and less. But if there's a new injury that comes, which can come 3-4 years later, then they'll come back again, and we'll need to do maybe 1 or 2 treatments. It's as if the body remembers the information, and it just starts from that point. So it's very easy to help people once they've had a baseline treatment with Bowen. is a 62-year-old male. He had a history of a brain tumor in February 1999. He has chief complaint, extreme pain in the neck post 8.5-hour surgery. He feels as if he's 100-pound weight has a 100-pound weight on the back of his neck and shoulder. He has difficulty walking, as if his head is disconnected from the rest of his body. So this is a post-surgery, and he was a very large man. He was actually a surgeon himself, but ended up needing a surgery. So he had his visit the 31st of May 2006, his first one. Then he came back in June. He was better 40 to 50%. He's able to control the movement of his traps, had increased energy. The 15th of June, a week later, his balance was much better. He had less vertigo, much more energy, increased control of muscles, and much less pain. He continued to improve into June, and by the 20th of June, he's now driving the first time since his surgery. He had a few more treatments, and basically no further treatments were required after that. Energy was back to pre-operation. He had full range of motion, no pain, and life was back to normal for the first time in 8 years. So imagine if he had known about Bowen earlier and could have avoided those painful 8 years. He might have been back to his job as a surgeon. KK is a male who's 76. Chief complaint, numbness and tingling in both feet with claudication. Other symptoms was suggested knee replacement for his right knee, also unable to lift his right knee and must manually place it to get in and out of a car. He has arthritis of the right hip and cramping in the legs. So again, I did 1, 2, 3, 4, 5, 6, 7, 8 treatments all together, and all his symptoms are gone. And this is in a 76-year-old man. RC is a 41-year-old female. Her complaints are repetitive strain injury with pain in the elbows and sciatic pain. So in 2 treatments, her sciatica resolved. In 2 further treatments, her elbows improved 80%. And then she canceled follow-ups after that because she got to 100%. KD is a male, 51. His first chief complaint is chronic hamstring tightness and low back pain, right inguinal hernia. The pertinent history is he's a chronic jogger and also a construction worker. He came in for 3 treatments. He can run again, and back pain is gone, is doing stretches prior to running as prescribed by his physio. Now you can imagine that I was not thrilled by that, but sometimes people will listen to what they feel is right, and that's what he was doing. The 14th of December, he had a relapse, so I treated him again. And on the 18th of January, 07, so this is, let me go back here, 06, so yeah, 07, he had a low back injury at work, and we did a treatment again. He had a full recovery. March 7th, he is stretching less prior and after running, notices much faster recovery time, and wants to do Bowen when he feels that his body is not getting the message. And that's his words. I see him once a month for work-related injuries. Each single treatment resolves the new injury. Again, typical of what I'm saying, once the body has what I would call the Bowen language, then it's easy to add new information and treat new injuries. CB is a 28-year-old female. She had a chief complaint herniated disc in the lumbar spine since a snowboarding accident in winter 2001. The pain averages 5 or 6 out of 10 and has increased to 7 or 8 out of 10 in the last 2 weeks prior to seeing me. Pain in thoracic vertebrae since 10 years due to scoliosis. She has a 22-degree deviation. Pain in the left knee, which was diagnosed as a pulled ligament, since 15 years after a sports accident. So her first treatment was 7th of April 2004. 22nd was the next one. Pain in the lumbar spine was decreased to a 4 or 5 out of 10. And tension felt in the body, but yet tension felt in the body. We did Bowen. 28th of April, she was pain-free until an accident on a boat, so new injury. Now her pain was back to 5 or 6 out of 10. She received a treatment. 26th of May, she canceled her appointment because she was 100% pain-free in her back, her knees, and the scoliosis has resolved, and she no longer has any curvature or deviation. The 29th of June, her low back pain, she has low back pain since the delivery of her baby. We did Bowen, and she had so 2 treatments and no need for further treatments. DB is a 61-year-old male. He came in the 3rd of December 2003 with acute sciatica. He has a history of chronic sciatica managed over the last 20 years with chiropractic and the use of an activator. The syndrome recurs approximately every 6 weeks, and the pain is so intense he has not slept in 2 days, and he basically can't concentrate. I did a partial Bowen treatment because sometimes when the pain is so intense and acute, you have to do less for the body. So he came back a week later. He reports that he had pain all night. He took 2 sleeping pills, and suddenly at 10 a.m. the pain evaporated. No pain since, and his sleep is excellent, and he now has a slight weakness in the right hip. So it's not uncommon that people will leave the office still in pain, and then that it evaporates or that it leaves. It takes, it's going to take the time that your body needs to align itself and to resolve the problem or decrease the inflammation so that the nerve is not entrapped anymore. And this fellow actually was a radio reporter, and yeah, I ended up receiving about 400 cases of sciatica after, because he went on his own show and started telling people, his experience, because he had sciatica on a regular basis for over 20 years and pretty well hasn't had it since. So let's see, why did he come in? Because, a weakness in the right hip. So we did another treatment. He's then the 4th of February, he had no problem since originally corrected. Since there is weakness. Oh, so he senses that there's some weakness in his hip, had an agonizing pain in his TMJ, which is an old symptom for him, and it passed on its own. Then his right kneecap hurt after belly dancing, so obviously his sciatica is definitely out of the picture. And so we did a Bowen treatment. The 10th of March, he had a shoulder injury from tennis. We did a Bowen treatment, followed by another one. And since then, on and off treatments for various injuries because he has an active sports life. Just a note about an old symptom returning. So with Bowen, the body, it elicits a healing response. And when a body really heals, then the old symptoms come back. Those that have not been fully treated properly, or that have been possibly just medicated or suppressed in one way or another, will re-expose themselves. And sometimes you actually have to treat them, and other times you don't need to treat them. They just pass on their own. So it's interesting that he had a reoccurrence of an old TMJ problem that did pass on its own. So after this, I have just slides of different research that has been done on Bowen therapy. And you can stop the videos. I'm not going to take too long on this section. And that's it. So I hope that this will answer some of your questions on how this works, how it's integrated, why it has, Bowen has such tremendous clinical results. I am not a scientist. I'm not a researcher. I'm a doctor. I'm a clinician, and my passion is being in my office, seeing incredible results. And I've shared just a few. I haven't even updated it. This is now 2015, so it was true then. It is still true now, and it continues this way. And my goal is to teach as many doctors and health professionals this incredible tool that can really change people's lives in a massive and huge way. So thank you very much for your time, and feel free to contact me if there's any questions. You can also reach me. I realize the email's not there. It's my full name, manon.boliger@bowencollege.com. And for just general class information and such, it's info@bowencollege.com. Thank you.